This conference will now be recorded.
Hi, everybody. This is the AnCan Mixed Blood Cancer Support Group, and it is September 7th, I do believe, 2023. And we have a small group, but we have a mighty group, and we don't have anybody new, so let's start with Jim and see, do you need some time, and what's going on?
No, I don't, but I could give a sort of update though, eventually.
Okay, we'll come back and see if anybody else needs anything first, and we'll come right back to you. Barbell, good morning to you. Good morning.
Good morning.
How's everything with you? Do you need some time?
I could.
Okay. Albert?
No, I'm good.
Okay, that's very easy. I don't need anything. I'm still going strong. And so, Jim, what's going on with you?
Well, about the only thing.
Hold on
Okay.
1 second, if you
Sure.
don't mind, because I just want to get this onto the recording.
Okay.
That this is the time of year when, for us now, we need some endorsements on great nonprofits.
Yes.
And if you go to our website and click on testimonials, it'll take you to that page. If you've endorsed us before, you cannot do it again. And some of you have, so thank you so much. But if you haven't endorsed us before and you feel like endorsing us, we're trying to gather the endorsements across all of AnCan so that we get our great nonprofit seal for 2023. So that goes also for anybody who's listening and enjoys the recordings. If you'd be good enough to endorse us, we would greatly appreciate it. Oh, and one other announcement is that we have an art class coming up. It's going to be on, I believe, Thursday the 21st. I'll just confirm that. And of course, those art classes are free and drop in, but you do have to register. And if you're not receiving the registration, and there won't be another reminder before then, you can send me an email, rd@ancan. Oh, better still, send it to Hannah, Hannah, Hannah @ancan.org, that you'd like to register, and Hannah will be she'll be sure to get you registered, and then we'll send you out the link. Hold on 1 second. The next class, I know that it was inspired by Hannah's trip to Montana, and the September art class is on September 21st, and it'll be at 8 p.m. Pacific. And I will also put the registration in the chat window too. So
8 p.m. Pacific?
Right. I was about to say.
Sorry, 8 p.m. Eastern. Sorry.
Oh.
I was going to say, I'm
8 p.m.
up at
Eastern.
11
Thank
o'clock.
you. 8 p.m. Eastern. Sorry, 5 p.m. Pacific. And what I'll do is I'll put the link for everybody on YouTube as well, so you'll find the link there. So you won't need to do that. So here's the link in the chat coming up right now. But if you haven't attended the classes, they're really good. We get a lot of rave reviews. So we don't expect Fräulein Barbell to attend because it's the middle of the night. But, unless you feel you're a real Künstler, in which case, please do.
I don't know. I haven't tried.
There's a lot of people, and I am not kidding about this. There's a lot of people who have never tried, and they go to Hannah's class, and they cannot believe what they're doing. I just spoke to
Y'all
somebody
give it a
yesterday,
try.
Joe Rosenbaum, who sometimes comes into this group,
He's
and
supposed to be good.
he's making greetings cards from watercolors and sending them to people, and they're in huge demand.
When is that
So
next class? What did you say?
September 21st.
Okay.
If you click on that link that's in the, if you click on the link that's in the
Pat.
chat window, it'll open up for you in the
Okay.
and you can register and go from there. All right,
Okay.
that's all I have to say. I'll be quiet now. Goodbye.
Goodbye, Rick.
And Sally, you didn't poll me, but I have some comments for the group too.
Oh, I'm sorry. I forgot you were there. I don't see you.
Not visible.
Very nice. Very nice.
I'm so sorry.
Oh, I'm crushed. I'm crushed.
Do you have your peanut butter and jelly sandwich to share?
No, but I had some cereal. I had some granola cereal with blueberries and walnuts on it.
Ooh, sounds good.
Yes.
Jim, what do you have to tell us?
Okay, current status is 5 years of treatment for the prostate cancer. I'm now on a treatment holiday, which has extended to 13 months.
Wow.
And it was interesting because let's see, in July, my testosterone started to recover up to 113. The end of August, it dropped and was at 34. Why, I don't know, but it went up and down, and it's up to 133 now. Okay, and the PSA test is still undetectable. So that's encouraging. So anyway, I go from month to month, and I get surprises every month, and it has been for the last 6+ years. So
You sure you don't have multiple myeloma? That seems like that's our story that we change every month.
I don't know. That I'm not quite sure, but that's another topic for discussion with the doctors, and where the blood counts are low, historically low, essentially, and where the red cell counts have been low by about 10 to 15% all along for the last 6 years. Except I seem to be okay and I function fine, and except for old age, but other than that, slowing down a bit. Unfortunately, the mind is about 55 and the body's 79. So there is a disconnect there. But
You
other
look
than that,
good. Does that
everything's
count?
good. Yep. So
Well,
far.
good. I'm glad you're on a holiday. I mean, that's got to make you feel better.
Well, actually, surprisingly, I feel worse. You'd say, now, how can that happen? Well, because as a part of the treatment plan, I was taking a small dose of the prednisone, and the prednisone was, I think, suppressing
Anti-inflammatory.
my arthritis.
Mhm.
And so the prednisone's gone, and the arthritis in the hands and the elbows and the shoulders sometimes starts to act up. So
Try Claritin, not Claritin D, just Claritin.
Claritin, what does that do?
It's an anti-inflammatory.
Oh, okay. Hey,
We in the MM world use it for bone pain, but I have found it helps with my arthritis as well.
okay. Is that a small dose, or is it
It's just Claritin, over-the-counter Claritin.
over the counter? What, a single pill is fine, or
Take one a day.
10
I will-
milligrams.
10? Ooh,
And do not get the -D, the decongestant. Just get the plain Claritin. And
just,
don't use CVS brand or somebody else's. Make sure it's Claritin.
oh, do not use the store brands.
Why don't you like the generic, Sally?
I've tried them and they don't seem to work.
What about Costco's Kirkland?
I don't know. I've only tried CVS and
Okay.
I found that Claritin always works. The others don't, and they're supposed to be the same thing, but I don't know.
Yeah.
Who
Costco's
knows
works for
what
me.
Big Pharma does?
Yeah.
But it really helps.
Costco's works okay for you, Al?
Yeah, Costco's Kirkland work for me fine.
Right. Yeah, and I find I don't take it that often, but I find that the generic works. And I will say, Jim, that we often tell people who are on chemotherapy to take a Claritin. It helps them a lot with a bunch of different side effects.
Oh, I will make a note about that because eventually it will be in my future, I'm sure.
Okay. Well, let's not go there right now.
Right. No,
So
no, no, no. But
no, we're not going there. But but Claritin, it's a fantastic suggestion on Sally's part. I mean, it really does. It really does seem to do the job. I don't know what the equivalent is when you go into the German pharmacy, Babel. What do they have? Which is like, I wouldn't even know what you'd call it in England, to be honest. I don't know what the
You have
European
different
equivalent
names
is.
for it.
It's an antihistamine, is what it is. And an
Yeah.
antihistamine is also, it reduces
I'm
inflammation.
confused. I have that.
So was this for bone pain? I missed the part. I was
Yes,
disconnected. Okay.
bone pain and some arthritis pain if it's due to inflammation.
Okay.
yes, thank you, Sally.
You're welcome.
Yeah, good one.
Barbell, how's the status with you?
Well, I have my checkup at the end of the month still. So that's in September, I think 24th or so. And then I will see, but I think I will be okay. No, I'm doing fine, really. I have a few other things coming up, like we have a patient day at our university clinic coming up also in September. So I have some things to do. It doesn't get boring, but health-wise, I'm okay. The only problem that I had was I had a rash on my feet, and that was really strange. It was from the ankle to the knee on both legs. At first, I thought I was stung by mosquitoes, but if you are stung by mosquitoes, you have these bites also on arms and maybe somewhere else, and I didn't. But I went to the pharmacy, got some cream, so I know how to treat it, no problem. But it was really strange because it was very itchy, and well, I looked like 100 bugs were biting my legs. And no
Have you
idea
changed
what that was.
anything like your clean? Have you changed any laundry detergents or your
No.
dry cleaners?
No, it's all the same. And actually, if it was the cleaners, I would have it somewhere else too, because I mean, I have a covering at night, and it's also on my arms, you know. So I would have it somewhere else too, not just from ankle to knee, and on both legs at the same time too.
Well, I was thinking if you'd taken a pair of pants, slacks to the cleaners, that's
Well,
good.
I wasn't wearing slacks because it was hot, and I only wore
okay.
this anyway. So there was no cloth, nothing on the feet.
Okay.
I noticed.
Going away
I
again.
noticed.
Takes a little time, but I can manage. But I thought it was really strange, you know.
It is strange.
But other than that, and I know your sister, Jim. I sent her the link from our presentation. I'm friends with her. You know, last time you said Sue, then I remembered. Yeah, Sue, I know.
Yep.
Barbell, that was an excellent video presentation. I think you linked on Facebook, the one that had let's see, was it Dr. Weirda and Dr. Lamana
Yeah,
responding to
the
questions
one
from?
about the Bruton tyrosine kinase inhibitors. I thought that was very good too because they spoke mostly about their experiences with the drug. And,
Yeah, they were fielding questions from other doctors and patients as
yeah,
well. So
yep.
that was really good, and I thought, yeah, of course the issues one of them they were dealing with was atrial fibrillation, which was a side effect of
Yeah.
ibrutinib and some of the other
That
BTK
also when you can
inhibitors.
stop drugs and when, how long to stop. I thought that was
Right.
interesting too, that you make a difference between a large surgery and a small surgery. You know, if it's only a small surgery, it's up to 5 days. If it's a large surgery, it's a week. You have to get off the drug. I didn't know that.
I can't help, I know nothing about it. Except
But you don't
Health
take
Tree is now,
myeloma, I guess.
well, Health Tree is now adding CLL to AML and multiple myeloma to their database. So they will be doing the same thing for CLL that they've done for MM with coaches and an entire university of information from, you know, what is it to future treatments and stuff. So it should be interesting.
Now, the problem is with future treatments, they're not available yet, and every disease is different. Actually,
Yes.
I think it's the most important thing is that you know your disease and what drugs fit your disease. And
Just
I
like
mean, all
MM.
these things are just a burden. You read all the side effects, you get more scared even. So it's,
Yep.
it's best, you know, you focus just on your disease and the drugs that you take.
You have to be an advocate for yourself for your own disease.
Definitely, definitely. I hear that all the time.
Yep. Al, how are we doing in your neck of the woods?
Yeah, well, like I was saying earlier, you know, it's a roller coaster. I have some days where I'm feeling good and I do well and all. It goes back to where I'm doing good if I don't do anything. So as long as I don't do anything where I use up any energy, I'm okay. And then all of a sudden, out of nowhere, I'll just have a couple of down days where I'm not very productive at all. Then I get my energy back, and then I'll do a couple things. I basically just run a lot of errands and just do honeydews around the house, but I take a lot of breaks in between. I can't go full throttle at anything.
Are you
I'll
on
get.
therapy?
I'm sorry.
Are you on therapy?
I'm on hydroxyurea.
Okay.
Yeah,
Well,
that's all.
sometimes it's the drugs that make you tired too.
Yeah, yeah. And again, it's the disease, the PV. Fatigue is part of it.
Mm-hmm.
And everybody's different. There's this one guy in one of these other groups right now. Where is he? I think he's up in like Yellowstone, but he hikes everywhere. There's this other guy. He flies everywhere. He's on the beach and everything. But again, everybody's journey is different.
Mm-hmm.
We all have the same disease, but everybody has it at a different level. There's a guy I know out of I think it's South Carolina. He's a retired police officer. He's nearing 70 years old, and he wakes up in the morning and he does weight training, but by noon he's drained, he's done, and the rest of the day it's probably watching TV and doing nothing. But he gets his workout in every day. And the guy looks fit. I mean, Jesus, I've seen some pictures of him, some videos of him that he posts on Facebook. Guy's an animal. He's guy's amazing. There's another guy, I think somewhere maybe in Denmark or somewhere. He's a soldier, and he's in the service there. And he's out there. He's got a picture of himself. He's out in the woods in some military training, and he's got his pants down to his knees, giving himself a shot of one of the what is it, a Fearon medicines that they give for PV. I think it's Bezremi is what he's on. But and I've asked about other medications because I'm seeing that a lot of these patients that have polycythemia vera, they're on different treatments and they're doing pretty well. And but again, my doctor says, if it's not broken, don't fix it. She's afraid to try something where if it doesn't work, then we got to start all over. And then where am I going to be? How am I going to feel? So if I'm moving along, it's like, let's leave it alone until it doesn't work anymore. Then we'll move on to something else.
That's sort of, again, like the watch and wait in multiple myeloma.
Yeah.
You gotta make a decision and try the best that you can find right now. And if it's working, don't mess it up.
Yeah. Well, I've talked to both my primary care doctor and my oncologist from Mayo, my doctor up at Mayo, and they both said the same thing. They're on the same page.
Yeah.
Yeah, they're reluctant to change medication if it's working, and
Right.
of course, and I guess blood cancers, they're so, even if two people have the same kind, like you say, different stages, different,
Genetics.
it's like it has different personality for Barbell than it has for me, and so forth.
Yeah. I think we talked about this before. What I'm finding out in some of these groups, because there's people there from all over the world, New Zealand, Australia. So there's there's like 3 different injection drugs, interferons for PV. And I'm finding out that it's the younger patients that they're giving it to. And in other countries, they're handing it out like candy. Where here, they start you at stage 1 with the medication, and if that doesn't work, then they move on, and then they move up and they move up. It's almost like there's a scale they go by. They're limited to what they could give out to a patient here in the States versus what's in other countries.
Because the FDA is stronger than the European drug people.
Yeah.
They can still give thalidomide in Europe where they can't give it here.
Yeah. So on another note, the woman across the street, she's young. She's, I think, like in her late 40s, 2 little kids. She's married, and we see her leave work all the time. Well, she's been home since June, and we hardly see her or anything. Well, my wife saw her just the other day outside, and my wife went over and talked to her, and oh, so you're not working anymore. And she ended up finding a lump herself, and she was diagnosed with non-Hodgkin's lymphoma in June. That was just like 3 days ago that we found out she had that. So I've sent her the link to AnCan, send her a couple notes, of PAN and some other foundations that help out cancer patients. And then I'm on this what they call a next door app on my phone.
Yep.
And here in town, this woman put a picture of her family, young couple. I think they got 4 kids, and she's having a GoFundMe for her husband, who was diagnosed just recently with non-Hodgkin's lymphoma. So
Both
I
of
did
them?
Yeah, I mean, they're not related or anything, but just found 2 people within a week. So again, I jumped in and sent info and links out to them and see if that goes anywhere.
Yeah,
Hopefully we'll see them here.
there's like 75 different types of non-Hodgkin's lymphoma. It's just, of course,
Wow.
some of them are more common, like CLL, but 75 different kinds.
Wow.
And they say in multiple myeloma, there's probably not 2 patients that are alike,
Yeah.
but there are only 7 distinct differences. And within those 7, they can't find any, there's just, people do not react the same. I mean, 2 people can have the same genetic makeup, the same age, and they give the same drugs, and one will work with one person and won't work with the other.
Right.
So anyway, thanks, Al. You're looking good.
Thank you. Thank you. You as
But I
well.
agree
You as
with
well.
your friend who gets up in the morning and does his exercises, because if I don't get up at 7 and walk by 7:30, I'm trying to get in at least 20 to 25 minutes in the morning before it gets really hot. I'm wiped out in the afternoon. I have to take a nap. I mean, about 3:30, I need about an
Yeah.
hour. And it's just
Yeah,
wearing.
hopefully that's what I'm going to start doing, because we should start cooling off here soon. And yeah, I need to get back on my bike and start moving around, because again, the fatigue, it's terrible sometimes. But I push myself, but then I pay for it.
Yeah. Yep. Anyway, Lynn, even though I don't see you, you're looking well.
Well, thank you, thank you. I did get a haircut, and so it's I have to get a haircut because my eyebrows get so wild and crazy.
You know, after 5 years, no, it's been only 4 years since my stem cell transplant, but after 4 years, my eyebrows are finally coming back. I have eyebrows again.
All right, all right. Well, for those that might tune in on the recording, I have small lymphocytic lymphoma, which is one of the 75 non-Hodgkin's types of lymphoma, and SLL, as it is, the abbreviation or acronym is basically the same disease as chronic lymphocytic leukemia. It's just a different manifestation. It's primarily in the lymph nodes, whereas CLL is primarily in the blood. So anyway,
Lynn, I thought SOL was something else.
nope, small lymphocytic lymphoma. Um,
Never mind. I'm not going to say it because we were
oh,
being recorded.
oh, okay. Oh, you okay? Yeah, okay. I'm with you. But anyway, I went to see my doctor this last week in Dallas, and it had been several months since I had seen him, and the blood work and everything all looked great, and that's significant because I've been on a drug holiday for 5 months now. I had been on a BTK inhibitor called ibrutinib. It was the very first one, and I'd been on it for 9 years, and so I'm on a drug holiday, and the blood work looked great. And I said, well, if it's looking great, how about if we stretch this next appointment out to 6 months? So I will go back again in March with the agreement
Wow.
that if anything feels abnormal, if I'm start having any B symptoms, I don't know whether B symptoms are used in your types of cancer, but that would be night sweats and um, fevers, unexplained fevers,
Hmm.
swollen lymph nodes, and so forth. If those things start occurring, then I would let him know. But in the meantime, I will get a blood work done, CBC, at probably at the end of November, 1st of December.
You
So
don't
anyway,
get
he
a
was very
monthly?
no, no, never have. Well, initially I did when I was first diagnosed, but not in a long time have I gotten a monthly. Um,
I wish.
I I asked him about uh, IVG. What do you call them, Barbara? IgG infusions. Uh,
IVIG.
IVIG.
IV. Yeah, right. And so I said I'm not wanting to get these, but I know that a lot of people get them because our immune systems are compromised and they're having trouble with infections and so forth. So he said, he would be willing to, um, schedule those for me if I needed them. But in the meantime, I'm not pushing for it. And
What do you know what your IgG is?
we're going to check that on the next visit.
Okay.
So,
You
Normally,
have
you don't get IVIG until your IgG goes below 400.
right. So I don't know whether I've looked at it. I think it's pretty close to the 400 mark.
Yeah. Mine's
Do you have
435.
any infections, Lynn?
What's that, Barbell?
Do you have any infections?
Not hardly at all.
Well, then it's not that bad.
Yeah.
Yeah,
What they
I had
usually
the yeah. I've done really quite well, even when we had grandkids living with us. I asked him about vaccines. You know, when you're in treatment, your immune system is even less responsive to vaccines. And
Right.
so I asked him about vaccines, and he suggested RSV,
Right.
flu, Shingrix, and pneumonia.
Yeah.
So
Mine said, and COVID.
yeah,
COVID, flu,
so
pneumonia, and he says I probably would never, ever get Shingrix vaccine because my immune system won't react to it. So he just said, stay on a Ciclovar, forever.
yeah, yeah. I asked him about that because I'm on Valtrex antiviral as well. I had shingles back in December, and asked him about should I come off of that or not. He said, well, uh, it's your decision if you want to come off when you run out, but it, it 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 keep you from getting shingles. You'll be glad, or if you get
Because
off
I've
of
heard
it,
so many people who've gotten the Shingrix vaccine, both of them. I think there's a 2-shot thing,
right, right.
but then they still get shingles. And my feeling is stay on a Ciclovar
Yeah,
or
I
whatever
see.
you're on.
I see Al's face. He was not expecting to hear that. One last thing to tell y'all about that I've just been involved with today. I've been on the phone with my mail order pharmacy because I got a prescription that came in the mail the other day. Uh, it was for 90 days for $200, and I said, wait a minute, time out. That's $800 in a year. I said I was getting it locally here for less than $3 a month. I was getting it what would have been less than $40 in a year is now going to cost me $800. And the
What
difference
drug?
is um, Flomax.
Oh, okay.
That's for yeah, it's not a cancer drug. It's
No, it's a
for
bone
guy.
drug.
It's for enlarged prostate. And
It's also for bones.
okay, so Flomax, or also called tamsulosin. But
Yeah.
but the difference was that the doctor had prescribed the brand name instead of the generic. So I'm going through the rigmarole to get the return authorization, to get the doctor to change the prescription back to generic. So that'll save me $760 in expenses in a year's time. That's not insignificant.
No, it's not.
So or either that or just quit taking it. So uh, which I know the doctor wouldn't want me to do. But anyway, that's just a side story that may be of interest always to you. When you're getting things like mail order, they automatically hit your bank account. If you're not checking, you don't know what they're charging for on this. So it's worth checking, especially in this day and time with inflation going crazy.
Good point. But for
So
anybody who has had the Shingrix vaccine, I would suggest getting a titer from your doctor to make sure that you did get a positive response and that you do have, the protection. And if you don't, go back on an antiviral as soon as you can.
yeah, I went or from the time I was diagnosed, I went 10 years without getting shingles until last year. So I guess it was 9 years I went. But fortunately, I got on antiviral for Shingrix or for shingles uh, the same day that I was diagnosed, and that really helped. But my wife had shingles a couple of years ago, and she was miserable for
Yep.
months.
Yep.
It was just a torment, a torment. So
I had a friend
uh,
get it, and he says he's never been in so much pain in his life. And he had it right across his chest, and on one side, obviously. And I mean, he doesn't even have cancer. He just got shingles.
yeah,
And It's just
Well,
awful.
I had it. I had it when I was 14, like you mentioned, across the trunk of the body,
Hmm.
and fortunately it only lasted about a week, but absolutely miserable. Just you're on fire in that area
Hmm.
where the nerves are inflamed and all.
Well, Ken's
Jim?
actually lasted about 4 months.
Yeah, I would say my wife's lasted at least 3 months. Jim's about to say something.
Well, actually, I was going to ask a question about the shingles. I was told that if you never had chicken pox, then your chances of getting it are slim. Is that true?
What will happen is you'll get the chicken pox. You're exposed to the
Mm-hmm.
virus, you'll get the chicken pox,
And not
which is not,
shingles.
and as an adult, that can be a really dangerous thing too.
I think there's a vaccination too against chickenpox.
Yeah, that'd be worth visiting with your doctor about.
Mm-hmm.
Okay.
But you can also have had chicken pox and not know it if it was a really mild case.
Yeah,
Yeah, that I don't know because I was a young child and
you started off at a very young age.
yes.
Well, I recall that when our son was
Makes me itch
diagnosed,
thinking about it.
I recall when our son was diagnosed with lymphoma back in the 1970s. He was 3 years old and he was in the pediatric ward at MD Anderson. And there was a real fear of a breakout of chickenpox because they said it was life threatening for those patients back in the 1970s. All those kids, a lot of them had leukemia, and for blood cancers, it would be a bad thing to have a chickenpox outbreak in a pediatric ward.
Ooh.
Now, there may be better things now. I can't remember what they gave me when I got it, but there was a medicine I got on right away that helped and turned it around. Well, it was it was Valtrex. It was
It's
it
an
was
antiviral.
it's the same one that I'm taking now every day, except it was a full dose.
They also use a cyclovar,
Yeah,
800 milligrams or greater
yeah. I
for
think I was
looking
using
at
a
shingles.
thousand. Yeah, I
Yep.
think I was using 1 gram. Yeah, I
Yep.
still have sensitivity in my hand right here. Well, you can't see it. I put it in front of the camera, and
Maybe that's why we can't see your faces because your hand's in front of the camera. But no, shingles is not anything to mess around with. Another lady online, she was asking what everybody thought she had, and it was almost in her eye. And if you get it in your
yeah,
eye, it's very dangerous.
yeah.
So be careful, Al. Go ask your doctor, get a titer test.
I got the first shot like a month ago, so I will be getting the second one here soon.
Okay, but ask him for a titer the next time you have a blood test.
Okay.
And if you haven't had your measles shot, but no, you didn't have a
He's
stem cell
frozen.
transplant. You don't need to worry about that. I had to have all my infant vaccines again, so that was fun. Well, the only thing I have an update on is I'm still on venetoclax. I'm still back in remission after 2 weeks of being out of remission. So it put me back in remission, and I have an appointment next week and see how long we're going to keep doing this. So I feel fine, except I'm tired like Al.
Yeah.
Sally, did they start you off at reduced dosage and step it up? They do
No,
that with CLL, SLL
they
because
did
of
that
the
with CLL, but I started with 400 milligrams and
okay.
never looked back. And I've had
Uh,
zero
How
side
long are you
effects.
taking it? How long
I've
have
had
you been taking it?
June 1st.
Oh yeah, yeah, it's not that long.
Mm-mm.
yeah, with CLL, there's that threat of tumor lysis, and that can
Yeah.
be life-threatening.
And and that normally starts with the first 2 or 3 doses, but he didn't even mention it. So I
Yeah.
didn't think to ask.
Bone marrow mostly.
Yeah. But anything that works, I'm all for. And they've got me on metaprednisone instead of Dex to go with the Kyprolis. So
Mhm.
I just want off everything by December so I can go on a cruise and to Southeast Asia. But I'm terrified of a new COVID outbreak because, you know, that would ruin everything. So has anybody heard anything about this new strain?
Well, I only know that a lot of people have it.
I know. That's
I
what's
took my
scary.
I took my wife to the doctor the other day with an eye infection and walk-in clinic, and they said it was Friday a week ago, and they said they were bombarded with flu and COVID patients because most of the regular primary care physicians were closed on Friday afternoon.
Oh,
So,
yeah.
we washed our hands when we left.
So
Uh,
is everyone getting this new COVID vaccine, the new booster coming out here like in a week or two?
Yes.
Mhm. Probably. We'll have it at the end of September. It's available here.
Yeah. It's supposed to be available here at the end of September as well.
Hmm.
All my doctors said definitely get it. So
Sally, how about medical coverage while you're on the cruise? We got the flu while we were on our cruise, and I didn't get any money back from my insurance on that. Which
really,
had kind of, yeah.
right.
Well, if you're outside the U.S., um, you don't have coverage.
look, I don't know.
Yeah, I mean that's a real issue.
Well, I have travel insurance and I don't know if that covers. I'll look at that too.
That probably covers if you got sick before the cruise, it reimburses your money. But
Right.
it's
But it
probably,
also will take care of if I get sick on the cruise, they'll fly me home.
Good.
yeah,
Yes.
yeah, I'd verify it because just the Tamiflu, I think back 5, 6 years ago, it cost us about $500
Wow.
plus.
I think about, I think we're allowed 70 pounds or something in our largest luggage. And I think probably 24 pounds of it is drugs that I'm taking with me.
You said Southeast Asia?
Yeah.
Where at? What are the ports?
Vietnam, Bangkok, Laos, Cambodia,
That's a large
one that
one.
starts with an M, and I don't remember.
Were you a nurse in the service over there?
Me? No.
Yeah. Okay.
No,
No.
I'm going on a Seabourn. So, and actually, I'm going to see a niece I haven't seen in about 55 years who lives in Bangkok.
Wow.
Bangkok is a beautiful city.
Yeah.
It is really interesting.
And this is going to be fun because it'll be over Christmas and New Year's. So,
Christmas is a pretty good time over there. I think you're going to miss some with the rain, some of the monsoons.
I'll stay on the ship if it's raining.
Oh no.
They
Oh
have a
no. I mean,
spa.
it isn't any big,
I, th-
yeah.
I think Jim could be your tour guide.
Yeah,
Yeah.
close. No, I would not go back. Hey, I was there once for 2 years, so that was enough.
I would imagine.
But thank you for your service.
Oh,
Yes.
thank you very much.
But thank you, Lynn. I'm going to check on that medical coverage, but the
Yeah, do
the
because
travel insurance is supposed to take care of everything, anything that interrupts my trip.
well, it might interrupt the trip, but is it going to pay for like
Like
doctors,
Tamiflu. Yeah.
right, drugs and all of
Right.
that stuff? Yeah, I would check because Medicare, no, will not pay.
So, well, I am taking with me, I've already got it from my primary care physician, a Z-Pack,
Oh, yeah.
I've got the regular antibiotics and things like that. I
Motion
asked him if I
sickness.
should take, if I can get a prescription for Paxlovid to take with me. He goes, ask me in December. I said, okay.
The thing that you should do, okay, is to get yourself a roll of the toilet paper, right? And take it down to about half. Stick it in a plastic bag and carry it wherever you go. Because over there in the Far East, you may not have
Oh,
a
I've traveled in the Far
place to
East.
go.
Yes, I know.
Oh, okay.
Yes. But I
I,
also have, I have little towelettes
yeah,
that,
yeah. I was about
they're all
to,
freeze dried, so they're tiny, and I have all that stuff and soap. And so when I'm out gadding about on the,
yes.
off the ship, that I have clean things. Oh, and I got an ionizer to wear on the plane, air purifier. You
Yeah.
can wear it around your neck.
Oh, okay.
I have another friend who travels a lot, and she said it saved her. Her husband got sick because he wouldn't wear one, and she didn't get sick, and he didn't, and so she swears by it. So gloves, masks. I feel like I'm on a hospital ship. Anyway, I have nothing else unless somebody has something else. It's good to see you all. I haven't seen you for a while. And, Lynn, I'm really glad you joined us. I feel like I'm talking to
Oh,
Casper the ghost.
I'm glad I'm looking good.
I've never seen you look better. But how are the grandkids? You haven't talked about them yet.
You talking to
Lynn?
me?
Yeah, Lynn.
They're doing fine. Of course, they don't live with us anymore. Their parents live over in Dallas, and we see them, on special occasions like birthdays.
Oh, okay.
But they are, I think, 6 years old and 9 years old. Just the typical sort of things. Back in school, losing some. The granddaughter's lost her two front teeth, so we know what she wants for Christmas, and she is she is a regular gymnast. Her mother did gymnastics and was a cheerleader, and uh, Ava can do all the flips and turns and twists, and of course she's going to gymnastic classes. But anyway, she's very very outgoing. She does not get um, her physical ability from me. Jim, the military wouldn't take me to Vietnam because I had polio, and they said
Oh,
you
well,
might stumble. They said
right.
you might stumble in the jungle. One leg is shorter than the other, and I walk with a slight limp. So, but
Hey,
I've
well,
had classmates so that I went to school with from elementary, junior high, and high school. They'll say, "Why are you limping?" And I'll say, "Well, I had polio when I was 2." You didn't know that? I said, "No, we didn't know that." Well, I walk like the rest of the senior citizens now.
yeah, no difference.
Well, I've had 3 doctors give me 4 different diagnoses as why my ankle is so sore when I walk. And so I'm about to give up and try to fix it myself. This is ridiculous. So,
I have a question. Does your join button work on the email?
Hmm?
who are you
Because
talking to?
mine doesn't work. Mine doesn't work. I get emails and it has a join link, and when I press it, it doesn't do anything.
Emails from whom?
You talking about the
I get
chat?
emails.
You talking about the chat on this Zoom
No,
call,
we
or you talk?
usually get an invitation, at least I do, for the blood cancer
Oh,
group.
okay. I know what you mean. You're talking about
Yeah,
when Alexa sends you an email saying the
right.
meeting is such, and it hits, you're supposed to hit join, and doesn't work.
It
I
doesn't
will
work.
add that to the list.
Okay, well, you have to tell her. I usually get on different ways. I mean, you find the link somewhere else too.
Right.
But I imagine if it doesn't work for others, it's also an issue because if they don't know how to get on,
Oh, I had a problem. I couldn't get on with Edge, the browser, Microsoft browser, wouldn't let me on. So I had to take it down and go back to Chrome, and Michelle helped me get through it. And
it's always
I
an
didn't know.
adventure using technology.
Yes, ain't it great?
Well, I'm using a different operating system. I'm using Linux, and
Yeah, Linux
but
is
uh,
good.
but the Chromium, Firefox will not work. So Chromium has always worked, but this time around it's not working for
Well,
the
that's what I was
for the
saying. Edge didn't work either.
yeah. And I used
So,
yeah, I know my camera's working because I used it on a Zoom call for the blood cancer uncensored group just last Saturday, I think it was. So
Today doesn't work.
uh, yeah, the camera. There's a light on up there with the camera, which is a built-in. I just turn the camera off and the light goes off, but when I turn it back on, no picture comes up. So I think it's a problem with the
go to.
GoToMeeting. Yeah, problem with GoToMeeting.
Ah, okay.
Maybe it'll be fixed next time around. Then you'll have to see me again.
And like I say, I have this little pop-up screen that I've never seen before. So I don't know what's going on.
Yeah, there is also a problem with, there is usually in the lower left-hand corner, there's a hand that you can click and where to raise your hand
Yeah.
and where to ask. There is nothing on the bottom except for the four things for the mic, camera, screen, and leave.
That's right. The same for
Well, I
And
me.
just
I only have, at the bottom of my screen, I only have the microphone and pause. And then I have this pop-up thing on the side that has, some other stuff, the chat and stuff like that. But I think what you're talking about, Jim, is only on Zoom.
No,
I just raised my hand. Can you see it?
no.
No.
Well, I just raised it. I'm gonna lower my hand.
No, because I think we're in the Shemer room and I'm generally in the other room. And the other room worked Monday night. So unless they change things between Monday night and tonight, which I wouldn't put it past them because I used to be IT guy. And
Oh,
so I knew better than to change things during the week because it ought to work. We always changed it, fetch on a Saturday, tested it out on a Sunday, and it better work on a Monday. So, but I don't know.
Well, I wasn't pulling your leg a while ago when I said I raised my hand. I actually have the little icon that you're talking about that was missing. It's down
Oh,
there on.
we
It's
thought
on.
you were kidding.
Yeah, no, it's there, and and the hand is showing up in the left corner of my blank
right.
screen, which doesn't have a camera. But if you don't see that little hand up in
No,
the corner, well, and
No,
it
I
gives me some.
don't have it. I don't have a hand to raise except
It's
my
not,
own.
and it also let me click on some other things. Well, that didn't do anything. They had some thumbs up, thumbs down, heart,
I
so
don't
forth.
have
And
these. No thumbs up, no thumbs down.
okay.
well, Lynn, I believe you have privileges as the organizer. So I don't know if
Well,
that,
so does Al and I. So do Al and I.
well, yeah, that's true.
And you don't have it.
No, I don't have it.
Well, I
So,
don't have it either.
well,
Well,
that's interesting.
we've been anointed by Michelle. She sprinkled us.
Missing all the fun.
Well, all I know is this is totally different than it's always been before.
Yeah, they
Can't help
are. improving things, they think.
But it doesn't have a lot of features. Sometimes you can change the background too. That one doesn't.
No.
You cannot change it.
Yeah, I could log in with the tablet or a different computer, but we're about
It's
finished
not
up.
worth it. Yeah.
Yeah. There's
Anyway,
always
we'll
next
see you
month.
next month.
Okay.
I've got to figure out what I'm doing now here.
Well, I'm leaving. So long.
So I'm going to stop recording.
Yes, you should stop it.